I'm Reagan, I'm a physical therapist, and I use JTECH products on a daily basis to improve the outcomes for my clients. What I've learned is that consistent outcomes is the best marketing possible, and developing a reputation as a solution-based provider over a service-based provider is primarily predicated on metrics and diagnostics. And so I use JTECH Medical Systems as my objective way of acquiring metrics. We had a collegiate athlete that was sent here by her surgeon. She was young, her MRI and X-ray were all negative for shoulder pathology. Abduction and external rotation, they were both fine, but end range internal rotation, there was a 25% difference. And then after some treatment to her spine, her end range internal rotation stability improved to less than 5% asymmetry without any exercise or any strengthening. That's the value, is we can see what the impact of our manual therapy is, not just on pain, but more importantly on function. Being able to objectify that and learn from past clinical cases has only helped me be a better clinician faster. I think it's imperative that we connect the JTECH system or the JTECH model with a movement assessment system, so that however I intervene, I have at least 2 layers of feedback. We have to be able to connect signs and symptoms and the interplay between the subjective experience and what we can objectively measure. And I find that the dynamometer is really important in objectifying end range stability, particularly of the shoulder and the hip. That is a layer of objectivity that doesn't require a biomechanics lab or a large investment. And that objectivity improves my outcomes. You really need to explore handheld dynamometry and explore the JTECH system, because I think that will add a layer of objectivity, and you'll be able to track your client's progress with greater accuracy and efficiency. And I think we need to really all be challenged and held accountable to be better diagnosticians, because time spent in assessment saves time in treatment, according to Vladimir Yonda. Now that I've started using JTECH products, particularly handheld dynamometry, I don't know how I could go back to just using my hands. I would feel like that would be a step backwards in my practice.